Adson's test and Roux's test. Make a note, therefore, a disorder called thoracic outlet syndrome. And you can write C future notes because we're going to talk about it coming up soon. So these are provocative tests that test for the presence of thoracic outlet syndrome. Thoracic outlet syndrome. Just for now, I want you to know that thoracic outlet syndrome is related to issues of nerve and vascular systems. So it's neurovascular structures, which we haven't talked a whole lot about. We've been talking more about muscles, tendons, joints. So what are some examples? The brachial plexus, one of the nerves that we're dealing with, or the artery subclavians. So right now I'm just going to show you how to do the test, and then in lecture we'll talk about why it happens, and I'll remind you. So what's first on your test? Adson's, right? Okay. Adson's is done a couple different positions. The first thing that I want to do is just palpate Sue's radial pulse at rest. Okay? There's no maneuvering of the shoulder. And I'm not counting it for this test. I'm palpating how strong the pulse is. So I'm kind of making a qualitative judgment in terms of how strong her pulse is. Spend a couple seconds there because I'm really using my fingers to do this evaluation. I get my judgment. Then I reposition Sue's body. And this is the position. The shoulder is going to go towards extension and external rotation. I keep palpating the pulse. Now I'm going to ask Sue to take a deep breath in, and then rotate your head towards me. And relax. Each time I do the maneuver, the shoulder, the hold your breath, and the rotate towards me, I'm putting further compression and strain on the brachial plexus and the vascular structures. A positive test is a diminished pulse during the maneuvers. So in other words, my test done here, I'm going to get a level of how strong the pulse is. And then at the end position, I'm going to have a diminished pulse. Does that make sense? That's indicative of a compression of the vascular structures, particularly the subclavians. Yeah, so the shoulder is extended and externally rotated. I'm going to palpate and ask you to take a deep breath in, hold it, and then turn your head towards me. Hello. And that's the end position.
Your head while holding breath.
Yeah. So rationale for holding the breath is it raises your rib cage up to pinch off structures, and when you turn your head, you're further pinching off. Okay? So that's Adson's. And again, it sounds weird right now because we're teaching it out of context, and